Good morning. Thanks for having me. My name is Felice Tong. I'm a medical student at the University of Sydney. Today I'll be presenting our systematic review and meta-analysis on the effect of preoperative psychological interventions on elective orthopedic surgery outcomes. None of the authors have any conflicts of disclosure to disclose. Despite elective arthroplasty and spinal surgery being generally very effective, a proportion of patients still remain dissatisfied, reporting pain and poor function postoperatively. Factors that may predict postoperative outcomes has hence attracted a large body of research. Preoperative psychological state has been demonstrated to be one such factor. This begs the question, can we apply any interventions preoperatively to improve the psychological state that will meaningfully impact our patients' postoperative outcomes? This is the question that we set out to answer. We searched 8 medical databases and gray literature spanning 1960 to January 2018. All types of elective orthopedic surgery were considered. Trauma orthopedics was excluded. Included studies had to be prospective, have a comparison control group, and apply psychological interventions preoperatively. All types of psychological interventions were considered. Outcomes of interest were pain, anxiety, quality of life, and function and disability measures. Methodological quality was assessed using the GRADE and Cochrane risk of bias assessment tool. So you can see that. After application of our inclusion criteria, we were left with 19 trials comprising 1,893 patients. 9 trials utilized relaxation techniques, 4 looked at cognitive behavioral interventions, 2 looked at hypnosis, 1 looked at emotional counseling, and 3 employed mixed psychological interventions. We analyzed studies grouped by outcome and then subgrouped for follow-up period. 18 studies reported on pain as a postoperative outcome. The majority of these were supportive for the benefit of preoperative psychological interventions. We are able to pull data from 7 studies for meta-analysis. This shows that the individuals receiving the preoperative psychological interventions were more likely to have less postoperative pain in the acute period. However, this result was statistically non-significant. For anxiety, 14 studies reported. The pooled data from 6 of these studies, comprising 589 patients, showed a statistically significant, moderately large effect in the acute postoperative period. 2 studies examined quality of life outcomes. Combined data analysis showed beneficial effect overall. In particular, there was a statistically significant improvement in mental quality of life in the longer-term follow-up period. 5 studies examined function and disability measures. All of these found statistically significant benefits. Unfortunately, heterogeneity in measurement and reporting precluded the pooling of data. The quality of the included studies was overall rated very low. This was due to small sample sizes and selection, detection, and attrition biases. Discrepancies in outcomes reporting also limited the amount of studies we could actually include into meta-analysis. That being said, this review gives meaningful insight into the state of the current research and allows us to draw some practical guidance clinically and as to the design and scope for future research. Clinically, it's important to note that no study reported any significant detrimental effects with these interventions. And although some studies examined interventions that were somewhat resource-intensive, such as one-on-one psychological counseling, many studies were able to demonstrate a benefit using lower-cost interventions, including standardized guided imagery CDs or audio tapes of relaxation exercises. These less resource-intensive interventions, in particular, have the potential to be easily implemented. This is particularly in Australia, where most public patients would attend preoperative assessment and information clinics, so the opportunity to engage is already there. However, does every single patient need it? We know that the one-size-fits-all approach is neither efficacious nor efficient in health. 3 of our studies independently reported that patient covariables, particularly baseline anxiety scores, correlated well with benefit effect size. Identifying patients at risk of a poor outcome due to psychological risk factors and then positively intervening just in that population would be a potentially economical and impactful strategy. With that in mind, we recommend that future studies consider this as a direction of research. More rigorously designed studies are called for. We recommend that future studies subscribe to a standardized set of patient-centered outcomes. Collaborations such as OMERACT and ICHOM groups have already made recommendations for some orthopedic conditions that could be used. This would provide much-needed consistency and facilitate comparison and pooling of data across more studies. Overall, the findings of this review support the use of preoperative strategies in improving postoperative orthopedic patient outcomes, particularly in anxiety and long-term mental quality of life. Thank you for having me.
Congratulations, well presented. Any questions from the delegates?
Parag, I have a question.
Thank you very much.
One question.
So, can you tell me, was there any difficulty in the patients in the papers you looked at? Were all these patients, did they have a reason for intervention, or were these patients who had no previous history?
No previous history. The papers specifically that we included specifically didn't exclude anyone with a psychological history, but it wasn't a specific inclusion criteria either. These were just blanket sort of everyone.
Right, so it's essentially all comers then?
Yes, so
Okay,
we're
that's
recommending that maybe we could narrow the catchment. Cool. Thank you again.
Thank you very much.